epidermal nerve fiber density testing. It's a test that's been widely used since the 90s. So it is pretty new. It's been out for a while, but it's since the 90s. It qualifies and quantifies small fiber neuropathy in terms of where it's actually looking at the number of healthy nerves that a patient has. It really provides you that definitive diagnosis of small fiber peripheral neuropathy. Just objective, doing a SEMMES Weinstein test or just taking clinical history is not enough to really diagnose the degree of the severity of the disease for the patient. You can't say if they have mild, moderate, borderline, severe neuropathy just by doing a vibratory test or by doing a monofilament test. So having this available in our hands really does help you determine the degree of severity. And if you wanted to go back 6 months, a year later and redo that test, you really have something to compare it to. Whereas if you've simply done a SEMMES Weinstein test at the office, you really can't base your follow-ups on that. So it is highly sensitive. It's very specific for small fiber neuropathy. As far as sensitivity of the skin, it is about 88% versus just 54% for clinical examination. And the specificity, as you can see, is very highly specific. It's about 95 to 97% specific. So with this test, not only are you diagnosing them properly, but that's the only diagnosis, and you're really able to determine the course and what borderline, if they're borderline mild, what degree of disease they have.